Mayama Krumzari adom na MBBS Impact News ni ay Joyshree Usham na Impact News ki Impact Health Link for a Healthy Manipur program asida taram nokchari. Ngasi akoy na puzarigli topic asi chemo-immunotherapy in cancer haiba sige matang dani aku pawarol thambina ba akoy gi studio de linkshin biriba experts miyam da shak mai takchage mingwan pazarbada Professor Dr. Shibashish Bhattacharyya MBBS MD Medicine DM Medical Oncology AIIMS New Delhi Head of the Department Kolkata Medical College and Hospital former Medical Director and Consultant MVR Cancer Center LLC Dubai and Evercare Hospital Dhaka Hozigna AIIMS Imphal, the consultant in medical oncology Obiri. Doctor, welcome to the show. Thank you so much for taking your time to be with us here today.
Kurunjai, namaste.
Kurunjari, doctor. Doctor, there are so many advancements in medical treatment, especially in cancer treatment. Though there is no cure yet, there are many treatment therapy which can relieve the patient of their cancer and illness and give them relief. So today we have brought this topic, chemo-immunotherapy in cancer. So first of all, we would like to know what is chemotherapy and what is immunotherapy?
Actually, this is a systemic treatment of cancer. When the treatment is given to the entire body, it is called systemic therapy. You can translate in your language so that people can understand, because I know that much of Manipuri only.
So, Dr. Natawi Bazi Hoziki chemotherapy, adagi immunotherapy ze, masi cancer patients in the whole body, systematic oiba whole body da mana target toba dugma treatment makhani haibiri.
So, in most of the cancer, it is in the stage 4 cancer where we use chemotherapy or immunotherapy.
Chemotherapy aduga immunotherapy zi cancer patient na moi stage 4 yobu matamda adu matamda chathaba line pathapne habiri.
And all blood cancers you need to give chemotherapy and immunotherapy. That is also always stage 4. There is no early stage in blood cancer.
No, aduga blood cancer ge wala di masi kano chemotherapy immunotherapy ze ma stage 4 da piba.
And in some cancer like breast cancer, in colon cancer, after operation or before operation, chemotherapy is given.
Okay.
In some cancer like colon cancer, stomach cancer, breast cancer,
breast cancer, di hariba chemotherapy, immunotherapy ze both chemo and immuno or
both chemo and immuno in some cases.
Okay, the cancer makan haribo zaki colon gi cancer, tibung tiring cancer, adagi breast cancer, adagi stomach ba puki cancer, sidadi huziki chemotherapy, immunotherapy ze cancer
operation before operation and after operation.
The operation ki matung da maina kanon piba.
Actually, today is the December month is the AIDS month, HIV, which is a big problem in Manipur.
Yes.
It is a third highest prevalence in entire India, although a small state, but number of cases are very high.
HIV/AIDS.
HIV/AIDS.
So, what is the relevance between chemo-immunotherapy and HIV/AIDS?
Yes, because in HIV/AIDS, whatever I told you, tell them.
Dr. Tapi Bazi, December thazi, akoina cancer, sorry, HIV/AIDS ka marila inaba maina akoina ngak pathani aduga Manipur ze India ge oina yam apik pa state mo betarga su mai cancer I beg your pardon. Hoziki HIV/AIDS ki case e masi yam wangi. It's a third
highest prevalence. Highest number of cases ratio
in India or in the Northeast?
In India.
India da hum su badala iri hari aduna aduga hoziki population wise
percentage is very high. Initially it was due to drug abuse because of the Burma border and drug infiltration. Now those children are young, so they do not tell that they are HIV positive.
Or so maybe they are not aware also.
They themselves are not aware. So that is why this year theme is testing for equity. All the suspected, all the young guys before marriage or sometimes before active sex life, they should get the testing. So that is most important, because now no more the intravenous drug is the commonest cause. Now 78% is due to sex related STD, sexually transmitted disease.
Dr. Tapi bazi akhoi ngarang waktu zo akhoi Manipur yara malam pumbada World AIDS Day akhoi na observe ta ukre. Ada Dr. Tapi bazi Manipur zi am pick pa serotar zo population wise yang pamatam da magi HIV AIDS ki prevalence am wangi thaina mamangai da di hoji HIV AIDS sador pazi hoji drugs kapa injection kapa degi main sador ami adu hoji ti moigi masa masu sing adagi atopa sing na mostly sexually transmitted oiba disease sexually transmitted mota sexual motor in hojiki HIV AIDS sadorkli haina Dr. Tambiri aduga chemo amosung immunotherapy asiga hoji HIV AIDS asiga kari mari laina bado habdo Dr. Yam khangmina kishi.
So in HIV related 3 cancers are very important. One is called Kaposi sarcoma. Kaposi, Kaposi sarcoma. Another is non-Hodgkin lymphoma, aggressive non-Hodgkin lymphoma. And third is cervical cancer. Females,
Okay.
cervical cancer, cervix in the genital tract. So all these 3 are virus related cancer. That is why we have made the discussion like that.
Okay. Dr. Tapi bazi hojiki HIV AIDS related ko series the cancer makhan ahum je yamna related oi hai ahan bada Kaposi sarcoma. Kaposi sarcoma. Medical terms kitang it's a bit difficult. Okay. Adagi ani su was aggressive
Non-Hodgkin
lymphoma. Adagi amana cervical cancer.
Cervical cancer from the genital tract of the female.
Nupi oi bising the cervical cancer. Hariba cancer makhala ahum ji hojiki HIV.
If the HIV is positive and these 3 cancer are there, you call them AIDS directly. So these are all AIDS defining criteria.
So hari miyam je AIDS ka mari laina ba adukumba cancer makhal ni aduna ngasigi akhoi gi topic si series da based orga pujarak pani.
So all these 3 cancers, Kaposi sarcoma, I can show the photographs, it is being downloaded. So they are skin cancer or in the inside the body also. This is a rare cancer due to virus, and it can be treated by anti-retroviral therapy, anti-HIV therapy. Once HIV treatment is done, this cancer is automatically suppressed because it is due to immune dysregulation. Body's own immunity is low, so these viruses are proliferating. So this is a cancer due to low immunity of the patient. Once the treatment of HIV is done, this Kaposi sarcoma gradually reduce.
But doctor, there is no cure for HIV yet.
HIV, there are treatment which can suppress the HIV and patient can live long, and this cancer will be delayed. They will not kill the patient immediately.
So this Kaposa, which is a skin Kaposi sarcoma, which is a skin cancer.
Skin cancer which may go inside the body also.
Okay.
During HIV, down immunity, low CD4 counts.
So doctor, like when HIV positive patient or a person with HIV has this
Kaposi sarcoma, you label him as AIDS.
Okay. So what kind of medicine will be given? What kind of medicine will be given?
Medicine is anti-retroviral therapy. Zidovudine, didanosine, all this treatment, whatever is given by the government, NACO, National AIDS Control Organization, Manipur AIDS Control Society. So they all distribute the anti-retroviral drug free of cost.
So instead of antiretroviral drug, is there any other therapy?
Yes, if the is not getting controlled, then you can use steroid. So to control the disease, and if still not, then chemotherapy will be given. Chemotherapy is the second phase when this antiretroviral is not getting controlled. So the chemotherapy can be given, and the second cancer where in addition to chemotherapy, you need to give immunotherapy. Non-Hodgkin lymphoma, you need to give immunotherapy.
So what is this non-Hodgkin lymphoma? What
it is a cancer of the lymph nodes. Entire body lymph nodes, there is cancerous due to Epstein-Barr virus. You can translate it.
Okay, this hoziki Dr. Takpi bazi hoziki aggressive
non-Hodgkin lymphoma is due to a virus.
Masiju virus ka mari na bani HIV virus ka mari na
HIV
bani.
and another virus.
What is the other virus?
EB virus.
EB virus hai basiga HIV virus asiga mari asina mari na rasadorak pa dum cancer makon ni adu masina lymph node akoi gi
lymph node.
Yeah.
Gut, all these places, axilla, inguinal region, all these places.
Dr. Takpiri baziki akoi haksang da smaina lymph mayam lai baze asi je sandorak pa dukumba mari lai na ba cancer makhalni. And how do we treat this?
We have to treat this with rituximab, which is immunotherapy. Immunotherapy will attack the lymphocyte, CD20 lymphocyte. So it is anti-CD20 antibody. We give an antibody to the body and that antibody will kill the CD20 positive cells.
Okay, what about the first one for the
Kaposi sarcoma? They are only antiretroviral or chemotherapy. There is no role of immunotherapy in Kaposi sarcoma. But in non-Hodgkin lymphoma, there is role of very important rituximab.
What about the antiviral?
Antiretroviral will be given.
Okay.
But in addition, chemo-immunotherapy has to be given because it is available in India, in our hospital, in everywhere, even in government sector, it is available.
What about the last one, the cervical?
Last one is cervical cancer. It is happening in the females. And without HIV, its incidence is much less.
Okay.
It is also due to virus.
So
HPV virus.
HPV virus.
HPV. You tell that?
Hariba hoziki mathaki han bada panjaki ba skin gima adagi lymph node thokpa asi cancer makhan ani sidi virus nezu thokan beyai aduga atopa virus makhala manas thogale hari hoziki ani suba lymph node thokpa cancer makhala je aduga aroi bagi si cervical cancer na sina nupi gi oiba nupi doina thengna ba aduga Dr. Takpi bazi masi HPV hariba virus makhal sina su thogali aduga HIV nasu it is also caused by HIV.
HIV increases the
risk
of HPV.
Okay.
So HPV gets flourished. All females might be having HPV, all will not develop cancer. But if HIV is positive, then the HPV gets flare up.
Aduna hoziki HPV je masigi virus je khoi nupi obi sing da changma matamda hoziki aduga nupi obi amaje maje HIV hande dum positive lai tar gadi hoziki HPV je mai mapangan kangan handuna hoziki cancer je thokan ba yaba ye chance wang hali haibani Dr. na takpi baje. So doctor, is it possible that like a woman having only HPV without HIV can also get cancer?
Yes. That their incidence is much less.
Much less. Okay.
Cervical cancer is always due to HPV and it can be prevented if in the puberty age, when they just start menstruation, that time if you give the vaccine.
So the vaccine is available now?
Available now, Gardasil. So for quadrivalent vaccine, so 4 important strains of virus will be prevented. So there will be very less chance of developing cervical cancer.
Thank you, doctor.
It is available worldwide. In India, it is freely available.
hariba cervical cancer ji masi HPV hariba virus makal sina thon bani aduga puberty hadi ahanba menstruation lak matam nupi macha sing jina moi adolescent ori ngai matam da hojiki hariba HPV gi masi ngakthungna bagi magi kana vaccine je kapthok pi bata gadi masi chawk matam da cervical cancer na bagi chang nem thari ha bagi doctor na thambiri aduga hariba hojiki cancer makal humasi all these 3 cancer can happen to any patient who has no HIV also.
No, Kaposi will normally not happen without HIV. But other cancers can happen without HIV.
Okay.
But they are very bad type and common type in HIV.
The hariba carposis hariba is skin cancer is the HIV positive like
that is the first sign of HIV. Initial 1981 this cancer was first seen among the people of
living with HIV.
Living with HIV was detected later. They were found with this cancer 1981 among the particular sexual orientation people, man having sex with man, MSM.
Okay.
This category was having this cancer. Later on it was discovered that it is due to HIV. First cause was not known. They found that cancer happening in 1981 in southern coast of USA.
So now, doctor, you said that this is very rare now.
Rare because of the good control of HIV. If you can control HIV, you have good drugs which can control HIV, cannot cure till now, but can control HIV, and people can live long. So incidence of Kaposi will be less. So the common cancers, if they live long after 50, so the common cancer like smoking related lung cancer, colon cancer, breast cancer, all will also happen. So in between this HIV, the immune suppression causes 3 cancers. They are called HIV defining criteria, AIDS defining criteria.
All these 3.
All these 3. Other cancers can happen like normal people because they are now living long.
Aduna hojiki ngasi doctor na maru ena panbikhiba carposis hariba skin da thokpa adagi aggressive non Hodgkin hariba lymph node da thokpa cancer, cervical cancer da ahamba sidi hojiki HIV AIDS ta thengna bani aduga ani suba sidi adum normal people hoji HIV gi infection lai tabasing dum thengna gani adu hariba laina ahum asi the hojiki chemo-immunotherapy asigi magi lying pathap sathabada magi achowa role lay masi amka khangmina kishi. Doctor, could you please emphasize more on how the chemo-immunotherapy will treat in this kind of cancer?
Yes. So last 2 cancers, non-Hodgkin lymphoma, it is a cancer of the lymph node, and there is a specific cell called CD20 positive lymphocyte. In blood there are 5 types of white blood cell, neutrophil, lymphocyte, monocyte, eosinophil, basophil. Among them, lymphocyte is the cancer non-Hodgkin lymphoma. If it is in the lymph node, so it is CD20 positive. So that is called B cell. CD20 is the marker of B cell. So you have got an antibody immunotherapy which is targeting against B cells, CD20 positive cells, to kill them. In addition, you are giving chemotherapy.
Okay.
So you can explain it.
Doctor, tapi bazi hozik chemo-immunotherapy is na kamay tawag habada the immuno will target
to the CD20 positive.
CD20 positive B cells. Ida target tawraga hoziki masi cells hatokpa. Aduga at the same time chemotherapy will be given.
Added.
Chemotherapy is pisanba. Aduga any other medicine or any other?
No, the and antiretroviral treatment for HIV positive patient will continue.
HIV kano positive or ba miyoy gi damakta di mai dum chaza bidak chu chaba aduga si ju mai treatment chathar taragadi mai cancer je lakshan bangam mi habigi.
So all cancer patients you should undertake HIV testing to know that if the patient is HIV positive or not, because it is a high prevalent state, and this is the month where this awareness needs to go to the population that there is no shame, there is no stigmatization, and you should test for HIV so that your cancer treatment can go smoothly, because your treatment protocol will change, dose will be adjusted because of the low immunity.
Doctor, tabi bazi akhoi hoji HIV is positive oi bro da bra have test tok thong mathok tai have di cancer ma na ba matam da HIV is positive oi ba targa di magi lying pathap chatha baje magi kan protocol le ma hongdor ka dorim ni aduna test tok baji amna mathok tai hairi aduga hoji stigmatization discrimination have gi wafam leite hoji masi magi infection ji phazna control taroga yai have baji me amna khangra wafam ni aduga ngarang mak world AIDS day and akhoi na palan tawre aduga whole month of December thaje akoina kano HIV AIDS gi awareness ki oiba dugumba thanina doctor nazu pungning thogat piri test tok thokpio haina doctor na thambiri adumaina test tok thokpa targadi positive oire hai targadi aduga cancer su na boy targadi mai cancer na bagi lying pathap sathabada tongan ba protocol lei aduna phajana test tok thokpa ji tangai fade habasi doctor na hanjan stress tawbiri adu matang aswaida ten commercial break am talawjagi break ki matungda ngasi gi akhoi topic chemo-immunotherapy in cancer makata na chathajage.
Dr. Helena Optometric College North AOC Imphal के academic session 2022-23 के admission hausare program offer Bachelor of Optometry specialties da matik charva infrastructure galoina na secure campus spacious classroom amadi well maintained library meritorious students singhi special fee concession amadi scholarship well qualified dedicated amadi experience lairaba oza singna takpi dambigani nupa macha amadi nupi macha gi secure amadi separate hostel Dr. Helena Eye Hospital and Institute Institute Daily Training ki khudong chabasu legani loinana course asi hek loibaga India amadi avorta chada chama job placement legani akupa marol gidamak 9774065535 ta contact tawbiu
Manipur gi oina ahanba makhalgi film making contest ama Buktaw X na miyamgi mafamda khudol tamjari. Chahi khudengi pangthokadaba Buktaw X Film Festival gi first season 2022 gi November 12 tagi December 12 hawa chathagani. Film festival asida yawbining basingna register tawraga yawbiba yagani. Buktaw X na pirakpa common theme amada hapta amagi manungda short film ama namgadabani. Akupa marol gidamak Buktaw X Instagram page asida changbiduna check tawbiu. Last date of registration is 4th December 2022. So hurry and register now.
Presto Personalized Wonders Imphal da nauna hangdok chari hairiba asida personalized gifts, corporate gifts, awards and mementos, home decor, office rubber stamp na chingba potlamsing mafam asida phangbigani ngasi maglangsing birau Tilak Ras Enterprises Presto Thangal Bazar near Kasturi Thong Imphal. Contact number 0385-244-9025 natraga 98621-00456.
This program is brought to you by Presto Personalized Wonders.
Break matungda amuka nataram nokchari. Doctor, before the break, you have
Discussed about the non-Hodgkin lymphoma.
yes. Now, after the break, we would like to come to the cervical cancer.
Cervical cancer was once the very common cancer, even in HIV negative or unknown patients long back. But with gradual improvement of the lifestyle, better genital hygiene, now cervical cancer in non-HIV patient is much less. Now in female, breast cancer is the commonest cancer in entire India. But unfortunately in HIV positive, cervical cancer in females is more common because reactivation of HPV virus.
Okay. Doctor, naam ka natapos hoziki HIV positive banupi singda hoziki cervical cancer na bagi changsi khwaidagi yam wang lei habasi doctor na thambiri.
So now it is very high because of HIV positive status. So any patient with cervical cancer, you need to test HIV and start antiretroviral therapy, and according to the stage of the cervical cancer. If it is in early stage, you can give radiotherapy, and if it is quite late, no benefit of radiotherapy, only chemo-immunotherapy will be given. Here the immunotherapy is bevacizumab, VEGF receptor antibody. So that is an antibody like non-Hodgkin lymphoma, it is CD20.
Yes.
Here it is VEGF. VEGF antibody.
Okay.
So this is given plus chemotherapy is given. So by this stage 4 cervical cancer, it can be controlled well.
It will be controlled for how many years? Because
It depends on the response to the chemotherapy and the HIV status. If the HIV is not back, the cancer also will be controlled. If HIV is again not controlled, because and she has got two diseases and both are only controllable. You know,
Not
nowadays
curable,
most
but
of the
controllable.
diseases are controllable, like diabetes. If you take medicine, it is controlled. If you don't take, or if the drug gets resistant, you have to add another drug or insulin. Same with hypertension. So most of the diseases in modern days are controllable, not curable. Cure is a word that is not possible in the complex diseases like diabetes, hypertension and cancer. For these diseases, for infectious diseases, cure is possible. But in spite of that, HIV is infectious disease. But for virus infection, especially HIV, retrovirus, there is no cure. It is only control.
And doctor, like for a woman who does not have HIV infection, and if she gets cervical cancer, let's say the first stage, then
so early stage it can live quite long, even in stage 3 can live more than 5 years, around 40 to 50%, 60% patient. But if it is in stage 4, then it is very bad.
Very bad, and like especially in stage 4, the progression would be very fast.
Rapid, and the death will be coming.
And doctor, you have mentioned that it is caused by HPV.
HPV, human papilloma virus, which can be prevented if given in early childhood.
That vaccine. And doctor, you mentioned about genital hygiene. So cervical cancer has, how is it related with genital hygiene?
It is sexually transmitted. So the genital hygiene is important.
Is it possible that a woman gets this cervical cancer without the sexual mode?
No, it is not possible.
So it is with the sexual
cancer. So it is the usage of barrier contraceptive, condoms and other things. This genital hygiene maintenance, this is important.
Okay.
Cleaning the area, all these things are very important.
So doctor, you are saying that this HPV virus will get into a woman's body only through
sexual intercourse. That is why before becoming active, then the vaccine is to be given.
Okay.
So normally it is given in males also.
So doctor,
because they develop anal cancer, there are different orientation among the male, and it causes oral cancer also.
Oral cancer and anal cancer.
Anal cancer is also caused by HPV virus. So this vaccine is effective in boys also to prevent.
Okay.
So because you never know what will be the orientation of the child.
Okay. All right. Now, doctor, we would also like to know benefits you have mentioned, because
the risk of these therapies are the side effects.
The side effects also we would like
to know.
Side
effects also you need to know, because during the therapy you will have further lowering of immunity.
Then how does it help then?
Yeah, that is the problem. To cure the cancer, we are killing the cancer cell, but non-cancer cell are also dying.
Okay.
So WBC neutrophil also will be low. So there will be chance of infection. So there will be chance of diarrhea. There will be chance of vomiting, hair loss. This hair loss is a mild problem. It will grow again. But vomiting is also preventable by good drugs, and the WBC count fall, that is myelotoxicity or bone marrow toxicity, it can be prevented by injection, so that the period of neutropenia, that cause of low immunity, can be reduced.
So all these other side medicine to
control the side effects.
So they will be given at the same time or at a different time?
It is after the chemotherapy. You will give after 24 hours those injections to increase the WBC count. You can tell.
Okay, Doctor, takpi bazi huziki hariba chemotherapy, immunotherapy to bazi mai gisu side effect like tabadi nati lai hari badi huziki cancer gi cell je harna bo khona tam da khoi gi hakchang de yaujaba aphaba cell jisu masi na sida halak doine aduna doctor takpi bazi huziki chemo amadi immunotherapy je pira matung da after 24 hours, right?
After 24 hours of completion.
Kun mari gi matung da atopa injection huziki atopa healthy cell je mai gi bapang jam kakhana bagi hida atopasu thagadoribani habasi doctor thambiri. Then doctor, December 6 is also a day for prevention of flu in cancer patients.
So flu means influenza. Actually this is the American terminology. Here we call influenza. So they call it flu.
And what are the symptoms of influenza?
Influenza is fever, headache, running nose, heaviness of the body, body ache, and you are down for 7 days. There is no specific drug which acts very well.
It's caused by virus?
It is caused by H1N1 virus. And it has similarity with the present havoc of coronavirus. similarity, but it is not the same. It is much lighter virus compared to the coronavirus. And like corona vaccine, this has also a vaccine. And this is December 6 to 12 is flu vaccine campaign month declared by WHO for prevention of flu in susceptible patients. All people will not require this vaccine. Young people, healthy people will not require. But when immunity is low, especially in cancer, diabetes, hypertension, heart disease, so all these chronic disease sufferer, they will require this vaccine during this season, October onwards. Anytime you can take a shot, and every year the character of the shot changes depending on the viral strain locally predominant.
Then, doctor, what is the impact of flu in a cancer patient?
Flu kills the cancer patient more than the normal non-cancer patient. So, the burden is quite high. So, all cancer patients, irrespective of age or other comorbidity, they should take a flu vaccine during October to it winds down since May. So, till May it can happen, from October to May. This is the season for flu, and lot of people, especially old age people, those who are in the homes or facilities for the old people. So, this is a epidemic unless they are vaccinated.
Doctor, takwi bazi huzik December ki tang taruk tagina 6 to 10, right? Masi kanogi prevention of flu WHO na maina piba pakta ki matung ina flu haidi lok lai hau tauba kok chikpa fever tauba runny nose si mayam jingak thopagi adugumba vaccination kap thopagi body ache su yaw deba adu mayam jingak thopagi maina palan tauba December 6 to 10 ni habiri aduga cancer na ba mioi sing or cancer survivor sing da hojiki flu lok lai hau toraga na ba jigi changji am wangen doctor takpiri aduna hojiki flu je prevent tauba ji tangai fade habisi doctor na thambiri. Now doctor, we have come to the almost at the end of the program, so I would like you to give some message regarding, you know.
So I will tell that everybody should be regularly having healthy diet, regular exercise, and check for HIV if you are having any high risk behavior, and if you are having any type of cancer, unfortunately, please go for the HIV testing in addition to your hepatitis B and hepatitis C. These two are also very common in Indian subcontinent, and they are also can produce cancer like liver cancer. So, lot many viruses are now identified for causing cancer, and which are very much preventable. Since we get a cause, we have the way to prevent. So, what you are initially telling is not true anymore, that cancer is not preventable. Cancer is preventable by vaccine in cervical cancer. Hepatitis B can be vaccinated to prevent hepatitis B. Hepatitis C, there is no vaccine yet, but it can be treated well with antiviral drugs. So, there are lot many cancers which are preventable. EB virus, which causes non-Hodgkin lymphoma, Hodgkin lymphoma, this is difficult. Till now there is no vaccine, and Kaposi as such is rare outside the HIV. And these are the cancers related to virus which can be prevented. And there are good treatment like CHEMO-IMMUNO which can treat the cancers and control, and like non-Hodgkin lymphoma, the patient can live quite long. You can call it a cure almost. So, it is a good thing that we are having all the facilities presently in Manipur. Our hospital is providing all the services with excellent infrastructure. I think we will progress further.
Thank you, Doctor. Doctor, Takwi Bazi, Hoziki Hariba cancer, Mayam Zimaroina, Hoziki virus, cervical cancer, Kumbazi, prevent Hobuto Ngamgani, have a Doctor Natambiri, Aduga, Hoziki chemotherapy, immunotherapy, Zigi, Mateng, Nauziki, cancer Mayamze, control Tobaze, Ngamgani, Duga, Hozik, American Oncology Institute at Babinash specialty hospital khabai shoi leiba cancer hospital as the magi facility miams leire aduna miam maru ebadi HIV leibra like tabra haise test tok thok piba haibadi HIV je positive oi tar di mai cancer ju na ba aduga HIV je positive oi tar di mai laing pathap se tongal mong da prostor ko darim ni na masi test tok thok pasitangai fadi tak piri aduga flu lok lai hon taw basi ju ngak thok na ba hona mina se haibasi doctor gi mai ke di thambiri doctor. This program is sponsored by Presto Enterprises, and it's a company which makes mementos and gift items. So we would like to give this from Presto and Impact TV to Doctor as a token of thanks. Thank you, Doctor. Thank you so much. Okay. Thank you, Doctor.
Thank you.
Ngasi kidi Impact News ki Impact Health Link for a Healthy Manipur program asi matang shwai loshlakli mathangi episode ta to palai na magi matang da expert pujun lakchege harga miyam lagi kaini no ya thangni jari. Thank you.
Shri Shri Gaurachandraya Namaha. Purbashram da ekhoi khwaibu konbiramba leisang them jilana magi nungsi jeraba imung manung sagaina te khwai punamak pu thadok lamlaga haukiba tang kuntra tha tara